7 years ago was at the absolute steadfast commitment of the people who carry out the mission of this organization each and every day. And while the rest of the world is hunkered down at homes, hopefully safely, healthcare professionals across the world and right here at Cook County Health are doing what they have always done, taking care of their patients and doing it with compassion, dedication, despite the challenges that COVID-19 presents. The staff, from the doctors and nurses to the food service and housekeeping, environmental service employees, are leaving their homes and their families and coming to care for their patients here. We should not overlook the stress of the healthcare workers and their families during this time. As a matter of fact, a special thank you to the families for basically allowing their loved ones to come and work with us. I would be remiss if I also did not take a moment to thank the healthcare workers in New York and surrounding states and other areas who have given advice and shared the lessons they've learned with the rest of the industry in an effort to save lives, including us, those of us here at Cook County Health. I know we are in the here and now. We are working around the clock to prevent the spread and save lives. But I also know that the moment that has the potential to define health care for the next several, I know this is the moment that has the potential to define health care for the next several generations. We will hopefully inspire the young, the high school sophomores, and others to consider a career as a nurse, a respiratory therapist, doctor, or healthcare professional. This moment will most certainly lead to lessons learned, medical advances, and treatments for COVID-19 and other infectious diseases. And there is no question that this moment will continue to challenge our stamina, but I have no doubt that the stories you tell about those on the front line will be stories you will tell your grandchildren someday, stories that will forever change the path of healthcare, and stories that will forever inspire me and everyone else. At this time, I'd like to introduce someone who's on the front line every day taking care of patients. He happens to also be our interim chair of emergency medicine, and pleased to work with him also as the president of the Cook County Health medical staff, Dr. Trevor Lewis.
Thank you, Deborah. Thank you, President Preckwinkle. My name is Trevor Lewis. I've actually been an emergency medicine physician here at the system for the last 23 years. I'm the interim chair of emergency medicine since July of last year. And during that time, over my 23 years at Cook County Health and in the emergency department, I've had the pleasure to work with some of the best and brightest minds in emergency and trauma care. But it's not just emergency and trauma, it's internal medicine, it's general surgery, it's our infectious disease team led by Dr. Sharon Welbel and David Schwartz, amazing physicians. Besides that, we've also had the pleasure to work with our nursing staff, incredibly dedicated, our social workers, our techs, our clerks, our physician assistants, our nurse practitioners. We have a very dedicated staff here at Cook County Hospital. And why do these people come to Cook County Hospital? Why are they so dedicated? We come here for the mission, and that's high quality, safe medical care regardless of ability to pay. And that's really what drew me here and draws my colleagues here. We're obviously facing some uncertain times ahead. As an emergency physician and being versed in disaster management, we've obviously prepared for disasters in the past. We've had the H1N1 experience. We've had the Ebola crisis, but nothing can prepare us for what we're about to face right now. COVID-19 is nothing that we have seen in this area, and my colleagues across the nation have not seen. What I have seen, though, behind the scenes for this facility and for this health system is an incredible camaraderie and coalescence of the health system. The medical staff, physicians, nursing, the ancillary services, our administration, our clinical leaders, our leaders of the hospital have all come together. Constant modeling, planning, surge, etc. We're drawing on our colleagues from other hospitals, and even to that end, we've also had great collaboration in our area with other hospitals on planning for this surge. I think it's been very important, and it gives me some solace to know that we have excellent preparations going on. I'd also like to say thanks to the head of our county board, President Preckwinkle. I think her message has been clear and resolute in this crisis, and it's also been echoed by the mayor and by the governor of the state. They've acted early, they've acted decisively, and that's probably the most important thing we can do right now. I'm often asked by colleagues, by friends, by people I know at home, what can I do to help? Because everybody wants to help. And I think the biggest or the most important thing you can do to help our system, to help my colleagues, to help our patients, is listen to what people are saying. You really need to be fastidious in your hygiene at home, washing your hands as you interact with your family and other people. If you do have to cough, as President Preckwinkle stated, cough into your elbow, cover your cough, wash your hands. You need to be very smart about this, and they seem like basic things to talk about, but these are the most important things right now. The other thing to remember too is the stay-at-home edict that people have been talking about. Obviously, there are essential tasks that people need to do, and sometimes people will have to leave their house, but if not, this is really a time to hunker down and really observe some of these social distancing edicts. It's very important. If you want to help me, if you want to help my ER staff, if you want to help my patients, then what you can do is follow these edicts that have been set down by President Preckwinkle, the mayor, and the governor of the state. Thank you.
Rachel, do you have questions?
Can we talk about what the conversations with other municipal leaders have been like? And what insight they've shared, maybe?
A week ago Monday and then yesterday, we had a series of 4 sets of phone calls with the councils of governments across the county and shared with them what the county was doing. We had our Cook County Health and Hospital System staff on those calls. We had our emergency management staff on those calls. We had our Bureau of Economic Development on those calls. So we shared with them what we've been doing in our health system, what we've been doing around emergency management, and
it's Cook County Board President Tony Preckwinkle right there, along with Deborah Carey from Cook County Health and Dr. Trevor Lewis, an ER physician for 23 years. He said he has never seen anything quite like this before. The overall message from President Preckwinkle was expressing gratitude to the healthcare workers that are on the front lines right now. Deborah Carey made the point that it's not just those workers, it's their families who are going through the stress of this moment and this situation. Got official numbers in Cook County in terms of cases right now, 3,727. And President Preckwinkle again asking everyone to do their part. That is social distancing, washing your hands, personal hygiene, and of course, staying at home.
We'll be right back after a quick break.
As concerns grow over the coronavirus outbreak, turn to Eyewitness News for everything you need to keep you and your family safe. Every newscast and on the app.
Introducing Tide Power Pods
With Cat and Net. That is such a large load. Don't the stains sneak through? New Tide Power Pods can clean that whole situation. It's like 2 regular Tide Pods and then even more power. Even the largest of loads get clean. It's got to be Tide.
Sleep this amazing? That's Ezekiel Pure Z Sleep. Our gummies contain a unique botanical blend, while an optimal melatonin level means no next-day grogginess. ZQuil Pure Z's, naturally superior sleep.
What is Huntington Learning Center?
It's the best grades ever center.
It's the homework is actually kind of fun center.
It's the Show Math Who's Boss Center.
It's the Crush the SAT and the ACT Center.
It's the I Can Read This Center.
It's the Best Decision I Ever Made Center. Huntington Learning Center, improving grades, test scores, and confidence since 1977. Call 1-800-CAN-LEARN today. Personalized attention, proven results.
When your loved one in a nursing home is suffering from an unexplained injury, you need answers. You need Mom and Law. We'll discover the truth and fight for the compensation you deserve. Call 888-MOM-AND-LAW for a free consultation. Mom and Law.
What's going on around here? How did you do that?
David Blaine, The Magic Way, Wednesday, 10/9 Central on ABC.
Time and Temp brought to you by Healthy Driven Chicago. Learn more at healthydrivenchicago.com.
Jeopardy has a living legend.
I've won 5 karaoke trophies.
Where? All over the world?
No, there is a bar down the street.
Oh, hello.
Today, followed by Eyewitness News at 4. Live From Chicago's #1 news, ABC 7 Eyewitness News at 11 continues.
Time of the hour in breaking news, we just found out that the governor is expected to make a major announcement today.
Political reporter Craig Wall is live for us with these details. Craig.
Guys, we've learned that Governor J.B. Pritzker this afternoon at his 2:30 news conference is expected to announce that he is extending Illinois' stay-at-home order. Now, this is an order that went into effect on March 20th and was through April 7th. And it could coincide with, but we don't know the details yet of how long it's going to be. Over the weekend, President Trump extended his guidelines for safe social distancing and gatherings of no more than 10 through the end of the month. What is not clear right now is whether Governor Pritzker is going to extend it for another month, another 30 days, which he would have the authority to do, which would be until May 7th, or whether he's going to extend it through the end of April to coincide with the president's order. Details on his extension, we understand, are still being worked out, but this afternoon the governor is expected to announce Illinois' stay-at-home order is going to go on longer than the previous deadline of April 7th. We'll keep following this and bring you details as we have them. Back to you guys in the studio.
Craig, thank you. A Chicago hotel will open its doors to police officers and firefighters during the fight against the coronavirus. The mayor just announced the Hotel Essex will be a safe place for those first responders to go to.
Diane Patthew is live at police headquarters with more on this. Diane.
That's right. The mayor announcing more support for those first responders on the front lines during this COVID-19 pandemic. After a very different graduation ceremony for the newest paramedics of the Chicago Fire Department, with less graduates in the room and spaced apart, Mayor Lightfoot announced a respite for police officers and firefighters. There will be 274 rooms available at the Hotel Essex on South Michigan Avenue. The idea is for these first responders to have a safe place to go if they feel sick or not, to relieve any fear of exposing their loved ones.
They are coming in contact with the virus every day and working long, hard hours. And some of them may prefer to stay downtown rather than going home to their spouse, kids, parents, or friends. And we are embarking on a critical moment of this crisis.
The mayor's comments came after 34 new paramedics graduated today. They will hit the streets ahead of schedule. Their program was actually accelerated so they can hit the streets now when they are needed most during this pandemic. Reporting live outside of police headquarters at 35th and Michigan, Diane Patthew, ABC 7 Eyewitness News.
All right, Diane, thank you so much.
We are seeing more of the preparations inside of McCormick Place, as Chicago's largest convention center is turned into an alternate care facility. Jessica D'Onofrio shows us more.
It may look quiet here outside, but hundreds are inside putting together what many might call a hospital within McCormick Place. But the Army Corps of Engineers leading this lightning-fast effort is calling it an alternate care facility. It's where COVID-19 patients will be transported from local hospitals, patients who don't need intensive care but need treatment. They'll have a hospital bed, and each bed will have a 10-foot by 10-foot room. The open space in McCormick Place, a perfect spot for a site like this, according to the project's manager, who says this is unprecedented.
This is an all-hands-on-deck project here. It's really kind of inspiring to see how all different agencies at the local, the state, and the federal level are working with the public health officials and contractors and industry and really coming together.
The Army Corps of Engineers telling me they plan to have this facility up and running within days. The National Guard helping to assemble 500 beds and ultimately 3,000 by the end of April. In the war against the virus, increasing the number of hospital beds is a critical front, with tens of thousands possibly needed in the coming weeks. But existing hospitals will still treat the most ill. Reporting at McCormick Place, Jessica D'Onofrio, ABC 7 Eyewitness News.
An Illinois prison inmate has died from COVID-19. The victim was an inmate at Stateville Correctional Center in Joliet. 12 other inmates diagnosed with COVID-19 are in the hospital right now. State officials are considering putting infected inmates together because of minimal space. At least 134 inmates at the Cook County Jail have also tested positive for coronavirus.
The virus is affecting more of Chicago's men and women in blue. We've learned another 29 Chicago police officers have tested positive, and that brings the total number of cases within the department to 50. A group called Bank the Blue is behind a new effort to protect those first responders. It is providing free COVID-19 testing to CPD officers and supplies like hand sanitizer. And we are hearing from two local families, both grieving the loss of their grandfathers because of COVID-19.
He started getting some symptoms. He decided to go to the hospital just to check himself. It's very difficult to just understand or grasp the fact that he's gone.
Yusuf Quran had self-quarantined after a friend was diagnosed with the virus. He went to the hospital after developing symptoms, but was sent home and told to self-isolate. On Sunday, Yusuf died. That same day, Calvary Church of Naperville pastor Angel Escamilla passed away. His family says he started to feel ill with pneumonia last week.
My dad was he was an amazing man. I think he would encourage us that, if he could still be speaking to us right now, to allow our faith to be strong in this moment.
Pastor Escamilla's family were not allowed to be by his side during his last moments. Both men were 67.
It's terrible. 100,000 iPads and laptops are being distributed to Chicago public school students for e-learning. District officials say that they're working with schools and families right now to get kids both of those devices and internet access for classroom instruction.
The hardest part is not knowing who has access to what and the communication piece.
A little anxious, trying to better understand how they're going to roll this out, how this is, what the actual plan is.
About 65,000 laptops and iPads are already being used in schools. Those will go to families who need them most. The school district is in the process of buying another 37,000 new devices. Everyone needs to be e-learning by April 13th.
Mayor Lori Lightfoot does not mince words when it comes to conveying the importance of staying home and keeping physical distance from others. She has also mastered the look. You know, the one your mama gave you? So much so, it has gone viral.
I like posting funny stuff just to make my friends laugh, but I guess it made more than my friends laugh.
Danny Martinez says Mayor Lightfoot isn't playing, but that doesn't mean he can't have a little fun with her.
I put her in those pictures, and then I was like, man, this looks really funny.
Danny's memes have gone viral, and even Lightfoot herself gets a kick out of them.
I love them. In any difficult time, I think we've got to have a sense of balance, and humor is a big part of it.
Now that the mayor has a captive audience, she's capitalizing on that attention with a new PSA campaign.
Here's what's up. If I make this shot, you got to stay home.
Nothing wrong with a little humor to drive home a bigger point. And since Lightfoot isn't quitting her day job,
just stay home. Save lives.
She's glad to have one more person in her corner.
Spreading awareness, I feel, is the most important message here.
Well, even our ABC 7 set is making a cameo in the mayor's memes. One of David's latest posts has the mayor sitting at our anchor desk along with Illinois Governor Pritzker, his sign language interpreter, Michael Albert, and the state's public health director, Dr. Ngozi Ezike. You can keep up with David Martinez's memes on Instagram at Where's Lightfoot. Terrell, he has more than 25,000 followers already.
I bet. And that explains why. That's actually really good and really funny, too. The mayor made a really good point. It's all about balance, and we need humor to get through this. Let's take a live look outside right now. 39 degrees out there, ending March on a cold note, I guess you would say. Cold day today, coldest of the week. The lakefront might not even get out of the 40-degree territory today. Tracy Butler continues with our AccuWeather forecast from home. Hey, Tracy.
I think Dr. Ezike, if she wants, I can give her the weather clicker. I'm sure she can handle that and much more, as she already has been. Well, good morning, almost afternoon today. Lots of cloud cover with us out there, as you have seen, and it is going to stay fairly overcast through the day as well. Our temperatures right now, well, they haven't really moved that far away from where we had them this morning when I greeted you. 39 degrees right now in Lincolnshire, 37 degrees in Monee, 38 degrees at the lakefront. It is 38 in Sycamore and 40 right now in Kankakee. So where do we go from here? Yeah, not much higher than where we are right now. A chilly day, a chilly wind coming off of the lake. However, we do only go up from here. How is the month of April going to come in weather-wise? We'll talk about that. We'll review March a little bit, and that's coming up. Tanya and Terrell.
All right, Tracy, thank you. And still coming up, the I-Team helps you to navigate the new challenges at the grocery store.
I'm Alfonso, and there's more to me than HIV. There's my career, my cause, my choir. I'm a work in progress. So much goes into who I am. HIV medicine is one part of it.
Prescription Dovato is for adults who are starting HIV-1 treatment and who aren't resistant to either of the medicines dolutegravir or lamivudine. Dovato has 2 medicines in 1 pill to help you reach and then stay undetectable, so your HIV can be controlled with fewer medicines while taking Dovato. You can take Dovato any time of day, with food or without. Don't take Dovato if you're allergic to any of its ingredients or if you take the Fatalide. If you have hepatitis B, it can change during treatment with Dovato and become harder to treat. Your hepatitis B may get worse or become life-threatening if you stop taking Dovato. So do not stop Dovato without talking to your doctor. Serious side effects can occur, including allergic reactions, liver problems, and liver failure. Life-threatening side effects include lactic acid buildup and severe liver problems. If you have a rash and other symptoms of an allergic reaction, stop taking Dovato and get medical help right away. Tell your doctor if you have kidney or liver problems, including hepatitis B or C. One of the ingredients in Dovato may harm your unborn baby. Your doctor may prescribe a different medicine than Dovato. Your doctor should do a pregnancy test before starting Dovato. Use effective birth control while taking Dovato. The most common side effects are headache, diarrhea, nausea, trouble sleeping, and tiredness.
So much goes into who I am and hope to be.
Cash bonds and to be out on their own recognizance. And poor people in our county often spent weeks or months in jail simply because they couldn't pay the cash bond. So we've worked hard together to reduce the jail population. When I came in office in 2010, the daily census at the jail was between 10 and 11,000 people. It has been lower than 6,000 for more than a year. Can't remember exactly how long. Nick can probably provide that with you later. It's now down to 5,000 as of last Friday, when we had a press conference with the sheriff at 26th in California. The sheriff estimated at that time that there were another 1,000 people who could safely be released from the jail who were accused of nonviolent crimes. And so the state's attorney and the public defender, along with our judges, have been working hard to try to get those 1,000 folks out of the jail and bring the jail population down to closer to 4,000. There are some people who are accused of violent crimes who need to remain behind bars, so we're always going to have people in the jail. The idea is to get as many people who are nonviolent and no danger to the community out as possible. The jail is a petri dish, and we will continue to have cases at the jail, and it will continue to be our biggest public health problem within the county. Deborah, do you want to speak to that?
Yes, I would speak to it in terms of the, I think there was a question about the boot camp and the capacity. We think that there's capacity for a few hundred, and that depends on, again, some of how we are housing some of the detainees. Obviously, those that are getting tested and do not have the result, we may give them a more space so that, again, if they come out negative, they won't be basically infected by the others. But remember, we also have multiple buildings on the campus where the jail is located, and so we do have the ability to isolate detainees in other buildings as well. So at this point, we have not identified that we are going to exhaust our capacity, but of course, this is, again, an area where we're monitoring every single day.
All right, John, do you have any more questions?
Nope, that's it, thanks.
All right, John. AD? No? Kristen? They're gone, apparently.
No, I'm okay. Thank you.
All right, Rachel, you're here. Did you get to ask all your questions?
I did. Thank you.
Okay?
All right, we're good.
All right, thank you all. Thank you all.
Thank you. Take care.
Thank you. Dr. Lewis? Thank you, Deborah.
I'm going to grab yours, but it's completely wet, so it's completely clean.
That's all right. Don't worry about it. All right, thank you, Michael Albert. Thank you, David Jones, wherever you went. All right, thank you.
Okay. So like within the whole compound, those buildings? Yeah, you post-date that. I do, yeah. When did that happen?
And who do we have with us on the phone? I see. Anonymous? Anonymous reporters, God help us. All right, John Byrne, thank you. Who else do we have? John Byrne from the Tribune, okay. Are we ready?
Not so close. Not so close.
Stay distance. Okay.
Yeah, they should be standing there. And Bob and Mr. Robinson. Yeah, we got a TV and sometimes. I'd give you a hug, but it's against the law.
I kind of like it this way. I can do this, right? When the camera will roll up, take the top.
Alderman?
Yes, sir. How are you?
Man?
I was waving at you when you was walking up here so swiftly.
I'm glad
I was like,
fast
Tim,
all the time now.
Tim. I said, no, he's in a hurry.
Do we, Mr. Robinson, want to be part of this?
Well, we want is distancing, right?
So I'm gonna. You want to say a few words?
No.
Mr. Robinson, want to say a few words?
No.
Come on, somebody's got to say something. All right, well, let's get you guys ready to go. Let's get started. Well, I want to welcome everybody to the new Roseland Hospital, the tip of the spear in the fight to flatten the curve. I want to thank everybody for being here. Especially want to recognize our warriors on the front line. These are some of our doctors and our nurses. Thank you so much for doing what you do and being here. It's so important in this effort to flatten that curve and fight this COVID-19 pandemic. But more importantly, I really want to recognize Robinson's Ribs for donating this food today to keep our employees and our patients nourished. I say I'm glad I'm not a patient here today, but I wish I was just to get this dinner. And I want to recognize our powerful alderman here, Carrie Austin. So let's start off with having Carrie say a few words. Thanks.
Thank you, Tim. I guess I can talk through this mask if I don't fog up my glasses. But I want to say giving all honor and praises to God for these people that have kept our hospital open. They've dedicated their lives to Roseland Hospital, and I would like to say, on behalf of the 34th Ward, we love and appreciate each and every one of you all for being dedicated to this hospital. I cannot say enough about you, Mr. Robinson. I hope you put some aside for us. But we thank you for your generosity, for doing this on behalf of Robinson Ribs. But thank you so much from Roseland Hospital as well as our ward. We really do appreciate you for all that you've done. I've had those before. Yes. And we thank you so very much. But again, how can we continue to help our medical staff so that we can stay safe, healthy, and before this is over with, happy? Hopefully, God will smile down on us again and make sure that this side of town stays happy, but for those that have dedicated themselves, at least stay fed. Thank you.
Thank you. We also wanted to take this opportunity to launch our COVID-19 testing program.
Yes.
We launched a task force over a month ago to focus on what we can do to help improve the outcome of this pandemic in our community, and led by our small safety net hospital. And the chairman of that task force is Dr. Applewhite. We want him to say a few words.
Yes, yes.
I'd like to begin by saying that at least give you some results regarding the amount of patients that we've tested thus far. At this point, we've tested 77 patients for COVID. We have 8 that were positive, 37 were negative, and we have 30 tests that are currently pending. We've had to do nasopharyngeal testing, which has taken us about 7 to 10 days to get the results back. As a result, we are now starting to use the serology testing, in which we can do approximately 144 tests within 2.5 hours. That process is going to involve our drive-through testing, where we utilize the current tents that you see here, and also nursing services and other ancillary services. The goal is to be able to provide services as quickly as possible and as accurate as we can, in addition to providing a mobile ambulatory unit, which will also be able to provide the same services, serology testing with results within 2.5 hours, again with 144 tests. This is a task we've had. We continue to have a lot of patients that continue to come daily, very, very sick. and we're at the point where we have to move forward as quickly as possible. Thank you.
Thank you, Dr. Applewhite. And we don't want this food to get cold, but we would be remiss if we didn't mention what is happening right now in terms of funding for the new Roseland Community Hospital. Right now, the powers that be are redesigning the hospital tax assessment program, which is the lifeblood for our hospital. And in that new assessment, it is proposed that Roseland lose $3.7 million in funding. Roseland Hospital can't lose one damn dime, let alone $3.7 million. So we must stand firm and ask our state of Illinois to invest in the new Roseland Hospital, which is leading the charge to flatten the curve against COVID-19. We need more funding, not less. This is no time for cuts. This is a time for investment. Thank you very much.
Thank you, Tim. Thank you.